Good morning. I first want to thank everyone who's taken the time out of their schedules to discuss the importance of our new strategy for decreasing the length of stay in our facility with our strategic goal planning session. My name is Kimberly Lewis, Clinical Manager of the Family Life Center. I am here to introduce to the facility directors and managers the concept of multidisciplinary discharge rounds. This plan requires full engagement and motivated participation by all stakeholders. So welcome to our physicians, nurses, managers, directors, case managers, and social work colleagues. Our strategic goal and why. The strategic goal is to align the service line areas of the antepartum and pediatric units at Children's Memorial Hermann Hospital to collaboratively institute multidisciplinary discharge rounds on these service lines to decrease the length of stay by March of 2019. With reimbursements decreased significantly and penalties imposed in our value-based purchasing healthcare climate, it is paramount that we ensure in this precarious market of healthcare that we are strategic in remaining viable in our community and the delivery of healthcare. Memorial Hermann Healthcare System received $1.2 million in penalties for readmission rates. MDRs are in line with our mission statement, but also will drive this strategic plan to ensure our nonprofit hospital can continue to serve our community for the next 100 years. Memorial Hermann is a long-standing, community-owned, nonprofit hospital dedicated to advancing health. Our mission statement is as follows. Memorial Hermann is a not-for-profit, community-owned healthcare system with spiritual values dedicated to providing high-quality services to improve the health of people throughout Southeast Texas. Memorial Hermann continues to drive their mission. With our SWOT analysis that has been proved by all of our stakeholders, we'll review this slide together. We have our strengths, our weaknesses, our threats and opportunities. With our strengths, we have established a successful guiding team with a successful model in place. That's with our postpartum unit or our Family Life Center. The opportunities are to increase financial gain, increase patient satisfaction, decrease 30-day admissions, all within the concept of multidisciplinary rounds. Our weakness, resistance from nursing staff, and currently lack of participation by in-house academia physicians. Some threats include remaining financially viable, and we do also have a large uninsured population. How are we going to accomplish our objectives with MDRs? The overarching goal of implementing MDRs is to decrease the length of stay. Decreasing the length of stay positions us in a financial advantage, allowing us to provide high quality, consistent care through a plan that details each discharge embedded in a pathway that will highlight barriers and trends. This was successfully accomplished in our Family Life Center. How this goal was accomplished was through gathering together and creating a task force and intentionally engaging every discipline, because we all know we must collaborate. Our physicians, nurses, charge nurses, managers, directors, case management, and social worker teams gathered. We noted what were the areas specifically that tasks or procedures are required to be completed in a certain time frame to assure timely discharge. This is not only a financially viable option, it also increases patient satisfaction as well. When people come to the hospital, they're at their most vulnerable, they're insecure, and they're scared. With MDRs, we give the patients a plan that details their pathway. This will instill trust and also give them guidance through their path. We also know as healthcare providers, discharge begins at admission. The next portion of the slide is when we meet at designated times. This is already planned in the Family Life Center. We meet at 9 a.m. Every nurse comes in and reports off every patient. When they report these patients, we're able to identify barriers to discharge. These barriers at times are very consistent. When we identify these barriers, we're able to change and also decrease these barriers, ultimately decreasing the length of stay. When this happens, it automatically decreases the length of stay and 30-day readmission rates, as well as increasing feedback to increase patient satisfaction. Passion to purpose. This slide is most important. This slide is allowing us as healthcare workers to really connect with what our patients need. I tell our patients and our staff daily, you only have your first baby once, or your third baby once, or your sixth baby once. But every experience is individualized because we as healthcare providers have the opportunity and awesome responsibility to make that experience what they want it to be. MDRs is a tool that not only solidifies our financial viability, but also provides high quality care to our patients because we're able to quickly identify trends. I am certain with the information provided in this presentation, it is clear we have a great template on how to ensure successful implementation in our antepartum and pediatric units. Thank you for your time and attention. If you have any questions or concerns, please feel free to contact me directly. Again, thank you and have a good day.